our millets have gone, and ragi is being replaced with oats and other exotic material. Unfortunately, we have a colonial mind. We are using term healthcare, but actually we are giving medical care. During COVID, we have seen that we were actually scaring people. We are actually living in what I would like to call it as a medicalization of society. Ayurveda and yoga both trail because the scientific research and scientific publications are much less as compared to traditional Chinese medicine and acupuncture. We hypothesized in 2000, I hypothesized that dosha prakriti has genetic connotation, and so we looked at genetics of vat, pitta, and kapha, and it has emerged into a new discipline today as known as Ayush genomics. This happens only because you have a great leader like Prime Minister Narendra Modi, who is supporting Indian knowledge systems in a big way. So we have to develop this articulation. We have to really start using the modern language without compromising our own concepts.
An introduction about Professor Bhushan Patwardhanji. He's the executive chairman of NAC, and he would be taking us through the session titled Evidence Based Ayurveda Glimpses of Transdisciplinary Research. Professor Bhushan Patwardhanji acts as the chairman of National Assessment and Accreditation Council, as the executive committee member, and he's been the former vice chairman of the University Grants Commission and the chairman of Indian Council of Social Science Research. He's a member of several academic research and policy committees such as Niti Aayog, Planning Commission, Lancet Citizens Commission, National Board of Examination, NCIM, Health Research Institute Australia, Fellow National Academy of Sciences and National Academy of Medical Sciences India. Currently, he is in the Ayush India lead for the Global Center for Traditional Medicine, World Health Organization Geneva, chairman of the Disciplinary R&D Task Force on COVID-19, and member and founder, editor-in-chief, Journal of Ayurveda and Integrative Medicine, published by Elsevier. Recipient of several orations, awards, holds, and he holds 8 Indian, 2 US patents, 175 plus scientific publications with over 11,600 citations that is listed amongst the world's top 2% scientists. We welcome Professor Patwardhanji.
My talk, I will focus on the our own work. What I will be mostly talking about is our own work, what we have done regarding the evidence-based Ayurveda. I also will share some of the articles later with the participants, which can be used as the material. I think I have sent some already to the organizers, and I hope they are with you. Thank you. I'll just to give you the my lecture schema. I will briefly give you introduction about our own schools, including my inspiration. So let me first start with the inspirations. Several people. I come from a biochemistry background, and because of the family culture and what was happening around me attracted me to look at Ayurveda and yoga from scientific point of view. And during this journey, several people inspired me. Those who see on screen, Professor B.M. Hegde, Professor M.S. Waliathan, Dr. Madhav Dev, Ashok Vaidya, Dr. V.M. Katoch, Dr. R.D. Lele, we just lost him a couple of months ago, and Dr. Sharadini Dhanukar also at very early age we lost her. But these people have tremendous contributions and have influenced my mind. And I would especially mention my mentor, Dr. Gururaj Mutalik, whom you see on this screen in front of the Harvard Medical School. And he himself is today 93 years old, but I spend time with him every year in Florida, where he resides and maintains a mini Gurukul. He was professor of medicine. He is founder of medical genetics, and also retired as director of WHO New York office. So such people actually are responsible for what I'm going to present to you. And this is my school, my university, and the whole group. What you see here, they all are our collaborators, and such kind of a work is not possible single-handedly unless thousands of hands and supports are available. Such work is not possible. We have a center of excellence by Ministry of Ayush, wherein we undertake various activities, including policy analysis, advocacy, translation, transdisciplinary scientific research, teaching and training, as well as collaborative consortia. I will be talking about transdisciplinary scientific research in this session. We started this research quite long back, in 1986 when we started working on immunology, and some of my MPharm and master students started their small projects looking at some of the Ayurvedic medicines from immunology point of view. Later, we went into rheumatology, then in public health, and I'm not going to discuss all the details, but this is what is the long journey from 1986 to 2022, when currently we are working on COVID-19. We have various other activities in the department, including in silico techniques. We have developed several analytical techniques. We have a yoga chair under which we undertake some research related to yoga. We run a public health course, MPH. We have been the first MPH of interdisciplinary nature. We have done a lot of work in publication ethics, also epistemology, meta research, and health policy. Let me start with healthcare, current scenario. We all know that biomedical sciences have progressed tremendously, but still the global crisis in healthcare is deepening. I put question marks because there could be different opinions, and I don't want to force my opinion on each one of you. So these are the question marks, and we have to find answers on our own based on what is happening around. The affordable and accessible healthcare is becoming a distant dream. The triple burden of disease and epidemic of non-communicable diseases is really causing us a lot of worry. Diet, lifestyle, socio-behavioral changes around us are happening, especially in India, when we are adopted the Western lifestyle, Western diets, and our original culture and original diet we are losing very fast. Our millets have gone, and ragi is being replaced with oats and other exotic material which we don't know whether they are really suitable to us. Geriatric population in having at least 2 to 3 chronic conditions, and there are reports that most of the geriatric population is on 4 to 5 medicines every day. The high-tech interventions and pharmaceutical drugs are becoming too myopic. We are going in a super specialization mode, wherein super specialists are not getting the total picture of human body and human mind. The societal expectations about drug safety and efficacy are rising, and the disease prevention and health promotion, which should be at the center stage, it has been taken over by therapeutic and cure based. This is happening because, unfortunately, we have a colonial mind even now, and we were forced to believe that health can be given through medicine and by doctors, which is not true. Health and medicine are not synonymous terms. Health is based on 4 important parameters, or we call them as determinants of health, which include genetics, nutrition, lifestyle, and environment. And as you can see, except genetics, all three are in our hand. Environment also is becoming more and more polluted, so that also is going out of hand. But nutrition and lifestyle are completely in our hand. We can decide whether to go on a healthy path or unhealthy path. And once any one of these 4 pillars of health becomes weak, you need a support system to maintain that balance of our own home. And that support system is medical care. But we have started thinking that that support system is the only thing to protect our health, which is not true really. We talk about SDGs and we talk about universal health coverage, but for a country like India, unless we involve and integrate Ayush systems, which are our own systems, universal healthcare in India is not possible. Currently, we are witnessing a situation wherein we are using term healthcare, but actually we are giving medical care. So the care is actually about primary healthcare, family medicine, health promotion, and health prevention. But we are in cure mode, which is about hospitals, surgeries, drugs, and diagnostics. And from cure, we are even moving further to scare. During COVID, we have seen that we were actually scaring people. This is coming up. This is going to happen. Even drug. If you look at different advertisements coming up in the newspapers, they're scary advertisement. If you have diabetes, there is a risk of amputation. So people are getting scared. And then we are even moving further from scare to scam, which we saw in COVID-19, that medicines which were proven to be not effective in randomized controlled clinical trials were sold in Indian market in black market, actually. What we are today witnessing. So the availability, accessibility, and affordability of healthcare is emerging again as a major problem, and we are actually living in what I would like to call it as a medicalization of society. On one side, there is a curative practice dominance. On the other side, there are market forces, and all this is really influencing our healthcare today. While the typical evidence level is going high because of the high quality and more scientific research happening, but because of the commercialization and its impact, the value systems are going down. So while high levels of evidence we are able to witness, low levels of ethics is something which is worrying us. If you look at the British Medical Journal 2016 data, in which they found out this is US data, and why I'm using US data is many times we have in our mind that US is something which we should follow, but the health system in US is not worth following. They are really in deep trouble. So they found out that what are the 10 top causes of deaths in US. They found out that first was, of course, heart diseases, second was cancer, and third was medical errors. Imagine, third cause of death was medical errors. Now the JAMA data 2021, because of COVID-19, this third position has been taken over by COVID-19, and they have changed the term medical error to unintentional injury. The basic message remains the same, that a lot of unintentional injury or medical error or iatrogenic diseases or whatever you may like to call, these are result of interventions or medical interventions which are happening. They are actually emerging as a major causes of disease. People are really worried about medical overuse. And journals like Lancet, BMJ, JAMA, they're coming out with a series of articles on the themes like less is more. That means less medicine will be more effective. Choosing wisely, too much of medicine, right care. All these is showing you, and the existential crisis which we witnessed during COVID-19 has really opened our eyes, and it has exposed our deficiencies of our current system. But as our Prime Minister says, that we need to find opportunities in adversities, and therefore we try to find opportunities in the COVID-19 adversities. And I'm going to share with you some of the data related to that which we did with Ministry of Ayush. Next part of my talk is about scientific research and evidence base. As I told you, this is based on our own research from our own group or from the group of our collaborators. Before going to that, let's look at what cytometric data is telling us. Cytometric data is telling us that why if we take Ayurveda and yoga, if you compare Ayurveda, traditional Chinese medicine is much, much, much more popular than us globally. But if you look at yoga alone, yoga surpasses the popularity index, quite extensively. Even traditional medicine and acupuncture together, yoga is much ahead. But the moment we shift from Google to Google Scholar, which is a scientific database, not very robust, but still scientific database, you will find that Ayurveda and yoga both trail, because the scientific research and scientific publications are much less as compared to traditional Chinese medicine and acupuncture. If you look at overall picture of India as scientific output, this is, I'm not talking only about Ayurveda or biomedical research, general scientific output or research output. If you compare 2 decades, you'll find that although Indian number of publication has increased, still our category normalized citation impact still remains below the global baseline, which is one, which means that although we may be publishing more, the impact of our publication is not yet to the desired level. If you compare biomedical research output happening in India, USA, China, and Germany, you will find that still India is lagging behind even China. Forget about the advanced countries like USA or Germany. Traditional and complementary medicine, this is the term normally is used. Traditional, complementary, and integrative medicine, which Ayush is part of it. And if you will see that the number of publications during the last decade has substantially increased. This shows that globally there is an interest in traditional medicine, and research in traditional medicine is on increase. While we do that, I must tell you that biomedical research, if you consider, people have come out with a data indicating that 85% of the research and spendings, I can't even count these zeros, is being wasted. We are involved in research which is not reproducible, And this article by John Ioannidis from Stanford is asking a question: why most published research findings are false? This is very serious. Lancet has run a series of articles on this subject. And if you look at the reality, evidence based medicine, what we talk about, the randomized controlled clinical trials output, if you see, most of the time or majority of the time, people have noticed that the results are going in favor of industry funded. So if the industry funding is governing or is driving the academic research, this is something what we must worry about. And therefore, I pose this question: for whom scientists are working? Are they working for business, or are they working for people? Now, next part is Ayurveda and innovation. This chart, what you see on the screen, it has 213 knowledge points drawn from Bruhatrai, classics of Ayurveda, Charak Sushrut and Vagbhat, or Madhav Nidan. These four books we have used, and you will see that from the concept like Loka and Purusha, we have connected the old dots by using nature biotechnology graphical notation up to Ashtanga Ayurveda. So concept like Pancha Mahabhuta connected to Tridosha, connected to Guna, Virya, Vipaka, Rasa, all these you will find with the color coding and forward and backward linkages. The chart I'll be happy to share with the organizers if you are interested to look at it micro detail. Let me tell you that every point of this chart can be exploded further into similar complicated charts. Why I'm telling you this is the beauty and vastness of our knowledge system. Ayurveda and yoga actually are sources of innovation. They are not just classic text. In general, Sanskrit only is the source of innovation. It's not a static or dying language, which many people are trying to tell us, which it is not. It is a language of knowledge, and innovations through basic concepts like Prakriti, Dosha, Rasa, Guna. All these are researchable areas, and IIT like institutions should get into this and do cutting edge research which will give leadership for India in scientific research. Because unfortunately today, although we are publishing more, the typical global leadership in science we are not. We are far away from. Nobel Prizes, if you look at from 2015 to 2018, starting from UU2 in 2015, her Nobel Prize was based on traditional Chinese medicine. She isolated anti-malarial drug using the reverse pharmacology approach, artemisinin, which has become a mainstream drug. Or in 2016, Nobel Prize has gone to autophagy. But if you look what autophagy actually is, it is about fasting. If you look at 2017 Nobel Prize, it is about biological rhythms. But what are biological rhythms? If you look at this biological rhythm article published in Nature and compare it with what I have published in our book on integrative approaches for health, this is about Dinacharya and Ritucharya. 2018 Nobel Prize, which has gone to immune regulation, is actually based on immune therapy. But what happens is when somebody else discovers we go back to our text and our books and we tell them, oh, what are you telling? We knew this thousands of years ago. We have to change this. We have to bring our knowledge upfront on the table in the laboratory, work on it, and tell the world that you did not know this. We knew this through our ancient knowledge, and this is how it works. This is the scientific leadership we have opportunity. Just one example of this, what you see on the screen. Chakrabarti from University of Texas published an excellent article on telomerase. And you know that telomerase are the ones which determine the longevity. They are ends of our chromosomes, and their length determines the longevity. And if you read what this article published in Cell, one of the highest impact factor journal, and if you read that article, you will feel as if you are reading concepts from Charak Samhita. And if you compare this chart with the chart again from our book, Integrative Approaches for Health, published by Elsevier, you will find many similarities. We hypothesized in 2000. I hypothesized that dosha prakriti has genetic connotation, and so we looked at genetics of vat, pitta, and kapha, and it has emerged into a new discipline today as known as Ayush genomics, and lot of high impact publications have come out of it. We have been able to also, Dr. Valiathan conceptualized this idea of Ayurvedic biology, and the scientific research was conducted at top institutions in India, including IITs, ICERs, and top universities. Projects were on dosha prakriti, genomics and epigenetics, panchakarma, effect of panchakarma on biology, rasayana and biology, Bhasmized nanoparticles, whole system studies, stem cell studies. All these was outcome of Ayurvedic biology. Lot of papers have emerged from Ayurvedic biology on Ayush genomics. This is the classic paper which we published in a scientific report, Nature scientific report, wherein we did genome-wide analysis and its correlates about Ayurveda Prakriti. This was the top 100 most downloaded papers from in which we identified that there is a PGM1 gene which plays important role in energy production, was predominant or was kind of a gene signature for Pitta Prakriti, which endorses our concepts of Vata, Pitta, and Kapha. Rasayana and longevity also. There have been a lot of publications. Rasayana and regeneration, stem cell and regenerative biology also in terms of rejuvenation is the typical concept in Rasayana. So a lot of research has gone in. Biology of Panchakarma has been studied by Dr. Urmila Thatte's group from KEM Mumbai, and they have shown that anti-inflammatory activity or the pro-inflammatory cytokine regulation was modulated during this Panchakarma. Lot of things are there to tell you, but time is limited. Our own group has worked on Rasayana, these 6 plants, Ashwagandha, Shatavari, Guduchi or Giloy, Haridra or Haldi, Amalaki, and Mulethi or Glycyrrhiza glabra. And we have published a lot of work related to immune modulation, which can be used in cancer adjuvant as well. So ashwagandha is one of the top plant we have studied. I'm going to leave this presentation with the organizer so you can go into details because there is no time now. This is the snapshot overview of studies we did during COVID-19. 126 clinical studies and 150 sites involving 130,000 participants. 66 trials on Ayurveda, 13 on yoga, 8 on Unani, 13 on Siddha, and 26 on homeopathy. Most of the trials were registered at CTRI. They followed good clinical practices, monitored by DSMB and CROs. And the outcomes of these trials have been published in peer-reviewed journals. This Ayush Sanjeevani mobile app attracted more than 15 million health seekers data, which has been also published, and we showed that 85% respondents used some way or other Ayush measures for prevention and management of COVID. This new study, which is underway, which is a statistically powered study on 7 different sites with 1,200 sample size, registered in CTRI, protocol has been published, in which we are going to see the effect of ashwagandha on immunogenicity of COVID vaccine. This is a 6 month study which is underway. Many publications are available and still coming up. We must go evidence and beyond. For example, if I ask you what is the evidence of using parachute, you know, and if at all we want to conduct a randomized control trial on parachute, who will be the volunteers? So not everything can be done through randomized controlled clinical trial. The picture which you see here is from British Medical Journal. So what I'm saying is evidence comes from experimental using scientific methods, but evidence also comes from traditional wisdom. Evidence also comes from experience. Evidence also comes from clinics. So the clinic-based evidence or practice-based evidence should also be equally valued. The concept of pramana or evidence in our own Shastra is very pronounced. Apta pratyaksha, anumana, and yukti. So, in normal way of looking at evidence is experiential evidence followed by observational, followed by exploratory, and top at the pyramid is RCTs or randomized controlled trials and uh, uh, the meta-analysis. But we don't know what comes first. So this kind of evidence, we have to imagine that epistemology of modern and ancient is different. While Ayurveda and yoga are based on Mahabhuta theory, modern medicine is based on molecular and physical concepts. So these are two different epistemology, and if you look at that from different angles, our condition will be like blind men looking at elephant. But I must add caution here that while I'm telling you that this epistemology is different and we must respect and work on traditional medicine knowledge or Ayurveda and yoga are great knowledge sources, I would also caution that we should not go into a trap of self pride and past glory syndrome, which we must avoid, because that is detrimental for our progress in science. I will skip some of the slides now, but at the end, I want to tell you that taking cognizance of all that what is happening in India, World Health Organization has identified India to establish its center, Global Center for Traditional Medicine, which will be established in Jamnagar. Just this year, our Prime Minister and WHO Director General launched this, and the work is going on. Vasudhaiva Kutumbakam, because Ayurveda and yoga are not only for India, they are for the world. And we have developed a big vision for this center, and we hope that this center will bring in a lot of more opportunities for collaboration in the future. We are also planning to organize a traditional medicine global conference on the sidelines of G20. This happens only because you have a great leader like Prime Minister Narendra Modi, who is supporting Indian knowledge systems in a big way. So it is now the responsibility of scientists to give a call, take up this call. And I would like to end by quoting this: Ayurveda owes its call not selfish goals or worldly pleasure, but to compassion for fellow beings. In seeking to know my legacy, you have but seen the leaves of universal tree, too vast for your eyes. May your sight grow and your quest never end. This is from Legacy of Charaka by Dr. M.S. Valiathan. I would like to thank IIT Kharagpur and all the organizers and participants for this opportunity and patient listening. And I must acknowledge and thank all my collaborators whom you see on the screen, because what I presented, they are not my own views, they are conglomeration and consolidation of various thought leaders who have inspired me and continue to do so. Namaskar, Jai Hind, Jai Bharat.
Good afternoon, sir. Sir, I am Mitali Mishra. I am doing my PhD on Ayurvedic biology. Sir, one of my question is, what should be the right approach for a scholar to integrate Ayurveda with modern science and technology so that we could get good publications in peer journals? What should be the right approach?
The right approach for research is using Ayurveda or yoga concepts, but taking modern science methodology and not blindly following the methodology, adopting or developing new methodology which will suit to test those concepts in a scientific manner. I showed you the example of paper published in Cell. look at that paper, read that paper, the kind of language they have used. So we have to develop this articulation. We have to really start using the modern language without compromising our own concepts. Because if we start equating pitta with fire, then the whole spirit of the research will be gone. So don't do that. I have seen in the past, even in the work in Ayurveda, for example, randomized controlled clinical trial. Now, when Ayurveda is considering every individual as different, how we can randomize? So there are ways to develop. So we have developed a new methodology called whole system methodology. Dr. Ram Manohar from Ayurveda pharmacy, now at Amrita University, he showed actually by taking a top scientist from US, Professor First from California University, showed that whole system research is possible without compromising the rigor of science. We should not compromise the rigor of science. At the same time, we should not compromise our own concepts. So if we balance this properly, and it is possible, we have shown through our research on AI genomics that this is very much possible. It is difficult, it is not easy, but we have to find our own way, and for that we have to build in very robust collaborations between Shastric and scientists together.